The cervical plexus will give off the great auricular nerve, and this is a contribution from C2 and C3, so great auricular nerve. Also the lesser occipital nerve, and this is from C2 nerve root. The transverse cervical nerve, this comes from C2 and C3. And then the supraclavicular nerves, these have contributions from C3 and C4. Okay, and these are supraclavicular nerves. You have an anterior, intermediate, and medial. Okay, the phrenic nerve, you can see here, this has contributions from C3, C4, C5 coming down, and the phrenic nerve will cross anterior to the anterior scalene when it's seen in the neck. Also seen here is the ansa cervicalis. This has a contribution from both C1 and C2. The hypoglossal nerve will be traversing just along with the superior root of the ansa cervicalis, and then gives off nerves to the geniohyoid and thyrohyoid muscles. Okay, the hypoglossal nerve is going to pass medial to the posterior belly of the digastrix and also deep to the mylohyoid muscle. The superior root of the ansa cervicalis is going to travel with the hypoglossal nerve. And if you trace this to the inferior root, this will form a loop. The superior laryngeal nerve is formed by the internal laryngeal nerve piercing the thyrohyoid membrane and the external laryngeal nerve. These are both branches of the superior laryngeal nerve, which is a branch off of cranial nerve 10, the vagus nerve. Okay, these are your nerve roots forming the cervical plexus, C1 to C5. So from C3 and C4, you'll have the supraclavicular nerves. You can also see the lesser occipital nerve coming from C2, the great auricular nerve coming from C2 and C3, and the transverse cervical nerve coming from C2 and C3. This is the hypoglossal nerve, and it's going to follow along with the superior root of the ansa cervicalis. Okay, so this is going to form a loop here. This is the superior loop, this is the inferior loop. So this has contributions from C1 and C2. And then you can see it gives off these branches here going to the infrahyoid or strap muscles. Okay, going to the geniohyoid muscle, this one is not coming off the ansa cervicalis. Here's another view. This is from Netter's. So here's your cervical plexus. You can see going posteriorly the lesser occipital nerve. Traversing anteriorly, you'll see the transverse cervical nerve. Diving inferiorly, these are supraclavicular nerves. Great auricular nerve is going to traverse posteriorly and then along the ear. And then this is the hypoglossal nerve, cranial nerve 12, nerve to the geniohyoid, and nerve to the thyrohyoid. Okay, coming off the ansa cervicalis, you'll have branches that go to the superior belly of the omohyoid, the sternothyroid, and sternohyoid muscles. Okay, also the inferior belly of the omohyoid.